Good morning, Sakina.
Good morning, doctor.
You must be Fatin. Please come in.
Dr. Fadi, I'm here today for Fatin. I'm worried about her. She's been passing out lately.
Fatin, can you tell me what's been happening?
I don't know exactly what's happening with me. When I wake up, I don't remember what happened, and when my mother explains it to me, I don't recall anything of what she describes. All I know is I have a bite on my tongue that hurts.
It must be very scary for you. Do you mind if I ask your mother about the situation?
No.
Can you describe to me, Sakina, what happened with Fatin?
Dr. Fadi, 3 days ago, Fatin was helping me in the house as usual. She was standing on the chair and I was handing her winter clothes to put away. Suddenly, she fell off the chair. Thankfully, she fell on the mattress. I tried to ask her what happened, but she was unable to answer me.
I see. You must have been very worried. Then what happened?
Then she became as rigid as a wooden board, and she turned blue.
How long did that last?
It felt like it lasted forever. Maybe 10 minutes. Then all her body started shaking and pink foam started going out of her mouth.
Did anything else happen?
Fatin, I think we can tell him, okay? Then she started wetting herself.
I'm glad you shared all the details of what happened with me, as it is helpful for me to understand what the problem may be. I have to ask more questions and perform a physical exam before confirming, but what you describe is called a convulsive seizure, and in this case a person might lose urine, sometimes feces, and it's not something that a person can control.
Dr. Fadi, after she woke up, she didn't recall anything.
How long was it before Fatin returned back to her normal self?
About 15 minutes.
Okay, Fatin, how did you feel after waking up?
I was very sleepy and I had a headache. I felt tired all day.
Did you have any warning that something was coming on? Like a strange smell, taste, or feeling, or even a feeling of dizziness or ringing in your ears?
No.
Are there convulsive seizures? Convulsive seizures are possible if there are convulsive movements, plus 2 or more of the criteria below. Ask about the following criteria: loss of or impaired consciousness, stiffness or rigidity lasting longer than 1 or 2 minutes, convulsive movements lasting longer than 1 or 2 minutes, tongue bite or self-injury, incontinence of urine and or feces. After the abnormal movement, fatigue, drowsiness, sleepiness, confusion, abnormal behavior, headache, or muscle aches.
Was this the first time this happened to you?
No, it's the third time. The first time was at home.
And the second time?
The second time, we were working in the fields close to the river. She almost drowned.
When did this happen?
A week ago, we took her directly to a traditional healer. She recited prayers, then gave her a potion to drink for 2 days and gave her an omelette to put around her neck. And she said that Fatin would fully recover in the coming days, but she needs to keep wearing the omelette for protection. But then she had a seizure a few days ago, so we decided to come see you, Dr. Fadi.
I see. We'll talk about the healer in a bit, but for now, I'd like to ask some more questions, if you don't mind.
Sure, doctor.
Fatin, do you suffer from any illness or is there anything else bothering you?
No, doctor.
Ask about other medical conditions. Are they diabetic? Are they on any medications? Could this be low blood sugar? Are they HIV positive? Are they on any medication? Could this be an infection? For example, meningitis or cerebral malaria?
I see that up until you started having seizures, you didn't have any other problems and you don't take any medications. I also wanted to ask you about your mood. How are you feeling lately?
Are there any concurrent conditions? Depression, self-harm, psychosis?
I would like to examine you now. Your blood pressure is good. I'll continue the examination. Follow my finger without moving your head. Great. Let me see your tongue. Stick it out further. Okay, great. Follow my moves. Again. Okay, great. Walk towards me.
What to look for on physical examination? Signs of head and or spinal trauma or tongue bites. Pupils and eye movements. Abnormal tone or strength in one limb. Abnormal coordination. Abnormal gait.
Fatin, I did not find any abnormalities in your physical examination.
What is happening with me, doctor?
The episodes that you had are called convulsive seizures. They have been caused by many things. In your case, there are no clear cause for them, and they occurred more than twice. In this case, we call it epilepsy.
What is epilepsy? The condition in which people experience recurrent, at least twice, unprovoked seizures. Recurrent, usually separated by days, weeks, or months. Unprovoked, there is no evidence of an acute cause of the seizure. For example, febrile seizure in a young child.
Epilepsy? Are you sure, doctor? Do we need to do any tests? No one in the family has epilepsy.
I understand your words, Hakina. What is happening with Fatin is called epilepsy. Epilepsy is not always hereditary, and there's no need for tests to be done for now.
Do you think she has epilepsy because of a bad spirit?
The seizures are not related to a bad spirit or possession. These are commonly held misconceptions. Epilepsy is a disease of the brain. Treatments of epilepsy requires medication. Please do tell me if you have any concerns or are suggested to take any traditional medicines. I want to be sure they don't interact or interfere with the medications I will ask you to take.